Hello everyone, it's me again, Dr. Babatunde Okewale. Today I'll be talking about when IVF fails, what happens next. It is a very emotive topic. But generally speaking, there are three things that could happen. The first is you take a break. The second is you try and understand why it failed. And the third is to decide with your fertility doctor on the way forward. So why do you need to take a break? Generally speaking, it is an advice your fertility doctor and your counselor gives. Apart from resting your body physically, you also need to rest your body psychologically, because IVF takes a toll psychologically on the body. But when we say take a break, it doesn't necessarily mean for too long. That is, if you are still planning on having IVF. Now, you need to understand why it failed. Why does IVF fail? There are 3 E's that are involved. I call them the 3 E's. It could fail because of the egg, it could fail because of the embryo, or it could fail because of the endometrium. I'll give an analogy. IVF can be likened to the work of a farmer. If a farmer comes to your farm, the farmer is interested in 2 things. He will be interested in your soil. He will check the soil and see whether it's a good soil for planting. He is also interested in the seed. He will check the seed and see whether the seed that he wants to plant in the soil are quality seeds. If both of them are okay, the chances of a good harvest is very high. In the same way with IVF, the seed is equivalent to the egg and the embryo, and the soil is equivalent to the endometrium, or the lining of the inside of the womb. The unfortunate thing is, all those 3 E's, the egg, the embryo, and the endometrium, are age dependent. So as a woman is growing older, the quality and the quantity of those 3 E's starts to decrease in the woman's body. So what could have gone wrong with the egg? Don't forget, when you're doing IVF, the first step is to stimulate the egg. Sometimes there is no response at all. And this happens in about 5 to 10% of all IVF stimulations. Sometimes the response is excessive, and we have what we call OHSS, ovarian hyperstimulation syndrome. Sometimes we think we are seeing follicles with eggs when we are doing ultrasound scan. We see a lot of follicles, but on the day of the retrieval, there are no eggs inside the follicle. We call this the empty follicular syndrome. Sometimes we get eggs. The eggs might be immature. The eggs might be over-mature. And so they don't get fertilized. And sometimes, even if they do get fertilized, the embryos get arrested and they do not grow further. So those are the things that could happen with the egg. What about the embryo? The embryo, there could be what we call failed implantation of the embryo. That is, the embryo just didn't implant. And when we are looking for what could have caused that, sometimes we can't find a reason, because we think we have put in or transferred a very good embryo. The endometrium looks okay, yet it still results in failed IVF. So sometimes we don't have any explanation. Sometimes it might be due to chromosomal problem with the embryo. The embryo might look good to the physical eye. It might look good to the embryologist when they are grading the embryo. The embryo might say, oh, the embryo is a grade A or a grade 1 embryo. But yet, the embryo might be carrying some chromosomal abnormality. And any embryo that is carrying any abnormal chromosomes could result in failed implantation. And sometimes the embryos are just poor. Now, sometimes patients ask, I was given a grade A embryo, so why didn't it work? And the only way I can explain that again is this. For example, if we were 10 in a room and someone comes into the room and I ask the person, looking at the 10 of us, who do you think is the healthiest? The way the person will judge us in terms of being healthy is the way we look. It will be physical assessment. They would look at all of us. If suddenly I got up and I started limping, they will say, oh, you are not as healthy as these other people. So it's all based on physical assessment. There's no way that person will know which of us, the 10 of us, has diabetes, is carrying cancer, or is hypertensive. In the same way, when the embryologist grades the embryo in the laboratory, majority of the assessment is based on the physical appearance of the embryo. It can be sometimes difficult to know which embryo is carrying chromosomal abnormality. The third reason why IVF could fail is the endometrium. The endometrium is the lining of the inside of the womb. The endometrium depends on estrogen. Estrogen is the female hormone, and it depends on a good blood flow. Anything that will reduce the blood flow inside the endometrium would affect implantation of the embryo. And what are the things that could reduce the blood flow inside the endometrium? Age is a big factor. As a woman grows older, her estrogen level starts dropping. The lining of the inside of the womb starts getting drier. Another factor could be scarring of the endometrium. An endometrium could be scarred from various things. It could be scarred due to infection of the endometrium, or it could be because of some operations that have been done inside the endometrium itself. Fibroids that are inside the womb or the endometrium can affect the blood flow. The blood flow that normally should supply the endometrium might be diverted into the fibroid, hence bringing about reduced blood flow in the endometrium. So those are the 3 E's that could cause failure in IVF: the egg, the embryo, and the endometrium. So, having known all this, the question now is, what do you do? Do you want to have another IVF? Or do you choose to even stop? These are questions your doctor, your fertility doctor, and your counselor would discuss with you. Sometimes the option might be that because of finances, I can't go through it again. Or I cannot go through it because of the emotions that are attached to it. Other options available to you include adoption and any other option that your fertility doctor might suggest. Could include surrogacy. So we've quickly gone through the things that could happen that makes IVF fail. Don't forget the 3 E's: the egg, the embryo, and the endometrium. If you want to know more about this, they're all written in my book called How to Get Pregnant and Have a Baby. It's available on Amazon. Thank you for listening and watching. Kindly subscribe to our YouTube page. Thank you.